Park East, Salamone, and Morelli.
Hartford Healthcare has opened a new Connecticut Orthopaedic Institute at MidState Medical Center, bringing together the state's best orthopedic surgeons to create a new center for care and recovery. Joining us this morning to talk to us more about it is Dr. Christopher Lynch. He's an orthopedic surgeon at the brand new institute. It's great to have you, Dr. Lynch.
Thanks, Jocelyn.
This is a state-of-the-art institute?
It is. First of all, I just want to mention, your daughter did a great job with your shoes there.
Thanks, Dr. Lynch. I'll be sure to share that with her.
So a little bit of background. So our group, 50 orthopedists, the Connecticut Orthopedic Specialists, realized early on that to provide high-quality, efficient care in things like our multiple offices and physical therapy offices, our walk-in orthopedic centers, and our surgery center, that you need to have input from the providers. So the physicians that are performing the surgeries and doing all the care need to be involved in making decisions on how the institute runs. And so Hartford Healthcare came to us and Connecticut Comprehensive Orthopedics in Meriden, basically asked us to design and essentially manage and run a brand new orthopedic institute of excellence. And so we've done that over the course of the last year. Now we have listened to our patients, we've sort of implemented what they've asked for, and now we're finally able to deliver what we set out to do.
And it opened about 3 months ago. So what are patients asking you to do, and how are they benefiting?
So I think in every hospital, patients are obviously cared for in the hospitals, but we really want them to feel like they're cared for. I don't know if everybody really feels like they're being cared for.
With that personal attention.
And so this, from the minute they sign up for the surgery, to the contact they have with the hospital prior to the surgery, to the valet parking that we have in the front, the escorting into the hospital, everything's localized in a small area, so there's not a lot of walking around. The ORs are built right underneath the floor, where we have 21 private beds on the floor, specialized hand-picked nurses and physical therapists, case managers that are really there to really take care of our patients.
And that is so important, because many patients now are complaining about they just don't have enough time with their doctors talking about what it is that they're dealing with, their health issues, and they feel like they're really just a number.
Yeah, I think this is a lot more hands-on, because it's a dedicated orthopedic institute. There's not the people that are on the floor, and the people caring for the patient are basically set in that one area. They're not traveling around the hospital seeing multiple other services. It's dedicated specifically to orthopedics, and ultimately this is a hospital within a hospital that we've built. They've given us a pavilion to work with and develop this.
And just really quickly, there's one last question. People always get injured at home, and so what should they be doing at home before they come see you?
Well, if they're really hurt, just come in and see us. But we have orthopedic walk-in centers if they need to do that. But I sort of tell my patients we're all falling apart slowly. But if you have aches and pains, you don't necessarily need to rush in. But if you have something that's really affecting your quality of life, then you ultimately come in and make an appointment to see an orthopedist.
All right, Dr. Lynch, thanks so much for joining us.
Thank you so much. Go Fairfield.
Okay. Let's head to the kitchen with Laura. Laura, what's happening over there? I understand you're dealing with some leftovers.
Yeah, Jocelyn, this is the best. For anyone who doesn't know what to make tonight, you're going to love this. Today's 8-minute meal, we have nutrition expert Dana Angela White with us. Show us how to make a great leftover meal. I think I fall right into this category.
Yes, this is what do I make, what's in the fridge,
yes.
Throw it all together. So no, you don't call for takeout. Instead, we're going to make our own pork fried rice.
Oh, okay. So what kind of items do you need to have in the house, or what do you sort of look for to put together a leftover meal?
Okay, so I mean, rice, you need rice. You need some cooked rice. So,
yes.
Maybe earlier in the week, use it for a meal, make a little bit extra or something.
Okay.
And then keep the leftovers in the fridge. And then it's really, let's have some protein. So today I'm using some leftover pork chop that I have from a dinner earlier in the week.
Yeah.
And then we throw in whatever vegetables. I go for whatever's in season, whatever's in the fridge.
Yep.
And then we're going to throw this together and make an amazing one-dish meal in, under 10 minutes.
Okay, and do you ever throw in like frozen veggies that you have, those steamed bags?
You totally
too?
can. Yeah,
Okay.
anything would go with this. So like these actually are uncooked, but they're going to steam really quickly and be ready by the end of the cooking. But you could use frozen. You could use something that's already cooked and sitting in the fridge. There's really anything goes with this.
Okay.
So you can make anybody happy.
That's usually all I ever have left.
Yes.
And you said you wanted to put something together quickly too to get started?
Yeah, so this is the sauce. So instead of using a bottled sauce,
Yeah.
you can make your own. So much more healthy. So we're just going to add, there's sesame oil, there's rice vinegar, some low sodium soy sauce.
Yep.
You can use tamari if you want to make it gluten-free too. A tiny little bit of sugar. We're going to use a tablespoon of sugar, which you buy this in a bottle, it's got a lot more than that. And some cornstarch. And that's the entire sauce for the entire dish.
Okay, and that's something that you can put together on your own, or you can probably come up with something that you have in the fridge too. So we're going to make this right now, and then we'll see how the whole meal comes together when we come back. But first, we are going to send things over to Jocelyn. Jocelyn's not there. Instead, we'll have a check of your top stories, how to protect your money. But right now, there's a new warning about chips in your credit and debit cards. We'll explain that one when we come back. Stay with us. You're watching Good Morning Connecticut at 9.